families. I'm Louise, and I'm the health counselor here at the clinic. I work with Dr. Bailey, and she asked that I come and spend a few minutes with you, if that's okay with you.
Sure.
Well, I'm here to talk about some of the questionnaires, to talk with you about some of the questionnaires that you completed prior to the visit. And this I really appreciate that you completed them. We've instituted this program of screening to really help us provide the best care that we can for people. So the one result that I did notice was on the screening for drug and alcohol, where it asks you about any kind of drug use. There was an indication on there that you did say that you use some drugs for non-medical reasons. But I'm wondering if you could tell me a little bit more about that.
You mean about the marijuana use? My husband and I smoke marijuana sometimes. Just in the evening, just to relax. It's not a big deal.
Mm-hmm. You indicated on there that it's just an occasional use, and it looks really like it's not causing you any kind of problems or anything in your life. You did indicate also on there that you sometimes felt bad about it. So I'm just wondering a little bit about that. What?
I mean, I don't feel horribly bad about it. It's just, even though it's legal now, society frowns on it. So that's what I meant by that. Just that.
Yeah, so it's just kind of left over that you're like, oh boy.
Yeah. Because it was illegal for so long, and so you were always told, oh, it's horrible for you. So that's it. Mm-hmm.
Well, I know that you discussed with Dr. Bailey what was happening with your heart and the follow-up from your earlier heart attack. And I'm wondering what, if anything, you know about the relationship between marijuana and heart health.
I guess I haven't really read anything about that, except, if you're smoking it, that I assume is pretty much like smoking cigarettes, and I know that's not good for your health in general, and not good for your lungs, and then not good for your heart. But that's all I would know, and I certainly don't smoke marijuana like if I smoked cigarettes, I would,
Yeah. Yeah. So you're kind of aware that it might have some impact, the smoking of it might have some impact on your heart.
Yeah. And that's when, my husband and I, Dan and I, have talked about that a little bit. So that's actually one of the reasons why we do sometimes just do the edibles, because then we figure we don't have to worry about that.
So you were concerned about wanting to make sure that you did whatever you did was then the served your health the best.
Well, yeah.
Would it be all right if I shared a little bit of information, some of the more recent research that's come out about the relationship between marijuana and your heart?
Okay.
Yeah. So there, as you might guess, there hasn't been a lot of research done yet because of the legal status, but there have been a handful of studies that have been done that really look at the relationship between and the effects of what marijuana has on your heart in particular. So it doesn't matter whether you ingest it or smoke it. For this, it has an effect. It increases your heart rate and also causes changes in your blood pressure. And they have also found that there's a higher risk for a heart attack in that period immediately after ingesting it. And that for people with heart disease, that might be an increased risk. What do you think?
Well, that doesn't sound very good. I have high blood pressure already, but I take medicine for that. So I don't know, but that maybe would negate the effects of the marijuana. I don't know. That doesn't sound very good.
And it sounds like you have some concerns about your health.
Well, yeah. I'm not ready to go yet. And I don't want to have another heart attack.
Yeah. What makes you not want to have a heart attack? What are you hanging around for?
Well, for my husband and for my kids and my knitting.
Before you think about what you might want to do, let me ask you this. On a scale of 1 to 10, with 1 being not at all important, and 10 being the most important thing, or one of the most important things you could do, how important would it be for you right now to make a change in how you use marijuana?
Well, I think if I became thoroughly convinced that it was so dangerous, I would be pretty convinced to stop. Like, and I don't think it would be that hard. So I don't know, 9 or something. I mean, if that's really the case, then of course I won't do it.
You're really the only one that can make that decision for yourself about the risks versus the benefits. My job is to try and help offer any information that you might need to make an informed decision about that, but it's really up to you what you would decide to do about that. And I really appreciate that you're willing and interested in taking the time to evaluate it and look at it for yourself.
So it probably sounds like it's not the best idea in the world to smoke marijuana. Okay.
You kind of feel like it's been kind of fun and you kind of like it and you're kind of wondering like maybe it's not the best thing for me right now.
Well, yeah, I mean, if that's really so, I have no intention or desire of spending another week in the hospital because of heart problem. That's for sure. I gave up red meat, so I guess I can. I mean, I haven't been doing it that long, and I'm not all addicted to it. I could give it up if that's the way it is. Yeah.
And you've already made other changes to sort of help with your managing your heart health and to make sure that you actively do what you can to prevent any further.
Right. Yeah. I guess this would just be one more change. Yeah. Yeah. I will say though, it does help me get to sleep.
Yeah.
And not that would make me risk having another heart attack, but you might have to tell me how to get to sleep too.
Well, that is certainly a conversation that we could have. I really appreciate that you've been talking to me about this. I know how hard it is, and you didn't come in expecting to talk about this.
No, I didn't.
This information really surprised you, and it kind of feels a little scary, and you really want to think about it. And so I'm happy to offer both the opportunity to really get together and talk about the other issues if you're ready. And I have information for you if you'd like.
It's the deal.
Good. Thanks.